So that's what's going on outside. But this means that there'll be no mad sounds going on in the background.
Hello, my name is Sherry, and this year I'm managing Beanstalk competition at Giant Health event. We welcome everyone participating and attending the event. First, I would like to briefly introduce the competition. Beanstalk is an international healthcare technology startup competition for prizes. Applicants who qualify the standards are invited to pitch their solutions in front of Precious Judge panel and the entire health and technology ecosystem. Looking at our agenda, we have 10 pitchers who will present their innovative solutions live or via pre-recorded videos. After each pitch, there will be 2 to 3 minutes for judges to ask questions. There will also be 3 speeches from our sponsors. The first speech is right after the introduction video and will be done by GJE, our main sponsor of Giant and Beanstalk event. The second speech is right after the 5th pitch and will be done by Granted Consultancy. After all 10 pitches from startups, there will be the last sponsor speech from Barclays. At 11:15, judges will have time to organize their assessment score. Then Adam Shaw, our MC, will finally announce the winners at 11:45. The awards are given based on the business stages. We have 3 business stages. Pollen indicates startups with an early prototype for testing. Bean are startups ready for paying users or patient trials. Lastly, startups in sprout stage have a functioning product and deployed with live customers. They are ready to scale. We have 3 startups in pollen stage, 3 startups in bin stage, and 4 startups in sprout stage who will compete in each business stage. The awards are given to 1 overall winner, 1 pollen winner, 1 bin winner, and 1 sprout winner. We officially named our overall winner awards after Michael Series, the founder of 11 Health and Technologies. 11 Health and Technologies is the world's first smart care platform for patients with long-term chronic conditions to medical bags. More detailed video of him will be played during Beanstalk event to honor him. This year, we have many companies providing us with many prizes. GJE provides Innovation Capture session for Bean, Pollen, and Sprout winner. The session will provide a full IP strategy consultation and report. Details of this session will also be explained in sponsor speech. In addition, all pitchers get IP strategy telephone consultations. The Heart Guide offers, first, the detailed review of pitch and executive summary to overall winner. In addition, all pitchers get 1-page review on the pitch and their executive summary. Just Entrepreneurs offer an online interview and 1 AirPrint magazine subscription for Bean, Pollen, and Sprout winner. Granted Consultancy provides tailored grant scope and 1-to-1 project exploration for Bean, Pollen, and Sprout winner. In addition, all pitchers get the grant funding landscape guide. More will be explained in the sponsor speech. Octopus Venture this year provides a dedicated session with Octopus Venture's portfolio team to overall winner. Lastly, Giant Health will feature the overall winner and Bean Pollen Sprout winner on Giant Healthy Innovator live TV chat show, as well as on Giant webpage, social media, newsletter, and magazine. In addition, all pitchers are also featured on Giant webpage, social media, newsletter, and magazine. I will finish the video by introducing our judge panel. Katerina is a founder and now a product lead of Lengtum, a workforce scheduling and staff management platform for healthcare. Adam is CEO of the Heart Guide, and he has also been helping business looking to position and pitch themselves correctly for funding. He is MC for today's Beanstalk event as well. Simon is co-founder of Remind Me Care, health-connected company focusing on products that support consumers and care business involved in care from diagnosis to end of life. Pilar is founder of iExpand, an advisory firm focusing on helping digital health companies scale and go global. Lastly, Rowena has been involved in healthcare transformation and innovation for a decade by running many healthcare events and speaking on many stages around the world. Thank you.
Hello, and a huge welcome from GJE to everyone out there joining us today for the Beanstalks competition. It's our absolute pleasure to be sponsoring the competition again this year and offering prizes to some of the winners. After chairing the competition last year and seeing the caliber of companies presenting, I'm excited for what we have in store today, and particularly now that the competition is reaching even more companies now that it's online. To briefly introduce myself and GJE, my name is Jack Severs. I'm a UK and European patent attorney at GJE, a specialist intellectual property law firm based here in London and in Munich. I lead our specialist medtech and health tech groups, and we specialise in working with health tech companies of all sizes to advise them in developing an IP strategy to protect their innovation and gain the maximum commercial value from it. Now, I've worked with enough founders to know that IP is not always top of their list in terms of considerations in the day-to-day running of their business. However, I'm also aware there's lots of misconceptions out there about IP and how to use it effectively. So what I'm going to do today is try to address some of these misconceptions and explain why IP strategy is more than simply registering a few IP rights, and ultimately answer the question, why is IP strategy important to health tech startups? Now, I don't need to tell anyone here that we are going through a period of rapid change in healthcare. Our current systems are struggling to cope with these changes and deal with the effects of aging population, climate change, and pollution. And of course, the COVID-19 pandemic this year has created even more problems for the healthcare system, which I'm pleased to see are being tackled by the sheer level of innovation by some of the health tech companies around the world. Now, many of the companies today are pitching solutions associated with some of these problems. And what always gives me hope is that I'm continually reminded in my day job about the level of innovation in health tech. The graph on the right shows the number of patents filed at the European Patent Office last year in the top 5 technology sectors. In fact, last year was unusual in that it was the first year recorded in which medical technology was not in first place and was pushed into a close second place by the huge increase in the number of applications filed for digital communication technologies. But it's clear that still, with almost 14,000 applications for new medtech and health tech inventions last year, it's a field in which innovation is progressing at a rapid rate. And I'm willing to bet with anyone here today that if I'm back here next year, we will see medtech back at the top of that list of technologies in which most applications are being filed, purely because COVID-19 has driven innovation to unprecedented levels. Now, innovation is all well and good, but the companies here today are not aiming to simply be innovative. Their task is to harness that innovation to actually provide some commercial value, to attract investment, grow their companies so that they can even make even more of an impact in solving those problems. And this is where IP strategy comes in. So many of you will have some knowledge of the different types of IP rights available: patents to protect concepts, trademarks to protect your brand, design rights covering the look of your product and the aesthetics, and know-how to protect your confidential information. And many people assume that that's where IP and my job as a patent attorney ends. But actually, filling in some paperwork to help you obtain IP rights is really only where it starts. And there are 2 main sides to my job. The first one is working with companies like those here today to help them understand their commercial aims and develop an IP strategy to support those aims. But the other side is working with investors, helping them with IP due diligence to analyze the IP portfolios of potential investment targets and provide feedback on the strengths and weaknesses so they can make an investment decision. And of course, that understanding of what investors want to see in an IP portfolio helps us to better advise the companies like those here today. So why is IP strategy so important to investors? Well, I think these graphs illustrate it quite nicely. They were taken from a report published last year by economists at the European Patent Office, who looked into the relationship between growth rates of SMEs and their IP position. They looked at high growth SMEs across Europe, where here they were defined as companies that have an increase in revenue of over 20% annually for 3 years running. Now, what they found is that, as shown in the graph on the left, even obtaining some IP rights increases the chances of growth by over 20% and increases the chance of the company being a high growth company by 10%. But what's more interesting to me is the graph on the right. This shows that companies with a combination of IP rights, i.e. with a coherent and full IP strategy, are a third more likely to be high growth companies. Now, of course, this doesn't mean that simply obtaining IP rights causes growth, but what it shows is that there's a clear correlation between an integrated IP portfolio and high growth rates. And that is why investors ask us to look into a company's IP position when they are considering investing. So we've seen the value of an IP strategy, but what exactly do we mean by IP strategy? Well, simply put, IP strategy is the coherent use of the IP framework as a whole to support a company's commercial aims. So a lot of companies will file an application and assume that that alone takes care of their IP strategy. We know from our due diligence work that this is not always the case. You can file an application that hasn't got a hope of getting granted, but you can still say that you have a pending patent application. Similarly, on the other side, part of IP strategy is looking at third-party rights and how they affect your company. Simply ignoring third-party rights, competitors' IP rights, is not going to be acceptable in the long run when an investor starts asking you questions about your freedom to operate during due diligence. So what we mean by IP strategy is, firstly, on one side, do you have a plan for how to identify and capture new innovation in your company? Have you checked that you're clear to use your brand names and have a strategy for when your company develops into different fields or new jurisdictions? And on the other side, can you demonstrate an appropriate approach to managing risk associated with third-party patents? The key point here is that there's no one-size-fits-all approach. The correct approach will come down to your specific business plan and your objectives. So I'd like to illustrate this with a case study. So this is PlaqueSnap, a company that I've made up based on various examples of real cases that I've worked on. So PlaqueSnap use a mobile phone app and a connecting mouthpiece, which allows you to take a picture of your mouth, which is then run through a machine learning algorithm to determine various health indicators relating to your oral health. For example, plaque levels, gum health, and then the data is stored and used to train the algorithm for better results. So how do PlaqueSnap approach protecting their innovation? Well, clearly, a lot of their innovation and value lies in this new machine learning classifier algorithm for analyzing image data to determine oral health conditions. And clearly they want to protect this. Perhaps an investor is asking whether they have appropriately protected it. Have they filed a patent application? Well, can they patent their algorithm? There's a lot of misconceptions around patenting software, but actually the answer is yes. They certainly can patent their algorithm, but is this the right route? If they file a patent application for the specifics of their back-end algorithm, this means that they will eventually end up making these details known when they might otherwise have been kept secret. On the other side, would they ever really know if a competitor was using the same algorithm in order to actually enforce their patent against the competitor? So in this case, perhaps they're better off keeping it as confidential know-how, which has an unlimited duration of protection, as long as you can keep the information confidential. And instead, can they patent the system as a whole? So file a patent application to the combination of the device with the camera, the mouthpiece, and a broadly defined processor to protect the overall system. If possible, this would provide much stronger protection because it's clear if a competitor is using a similar system to you. So that's patents and know-how. What about other IP rights? Well, I was pretty pleased myself with coming up with this company name, but can they protect it? Would it be considered descriptive and therefore not capable of being registered as a trademark? Have they carried out clearance searches to check whether it's actually usable in each of the countries in which they see as their main markets? And what about designs? These are frequently overlooked by companies as another means to protect their innovation. So in this case, a key question is whether the user interface could be protected by a registered design right. If you have developed a particularly recognizable user interface, this can provide really solid extra protection, particularly for technologies which are less protectable by patents, for example. So these are the things we're looking for when we talk about an IP strategy. Has the company used the full IP framework to correctly and effectively protect their innovation and the direction in which their innovation is moving in the future? These are the kind of things that an investor will look for when we're carrying out IP due diligence. And so thinking about these earlier can help you to make sure the company is investment ready and ultimately drive growth to allow you to better focus on the problems that you want to solve in the healthcare system. So to return to my original question, why is IP strategy important to health tech startups? The ultimate answer is it's difficult to derive value from your innovation and achieve growth without a credible IP strategy. So just to finish, these are the 3 practical tips that I would give you to summarize what I've said today. Firstly, there's no one-size-fits-all strategy. You need to develop a strategy that fits your business plan. Which aspects of your product do you need to protect? Which can be better protected by know-how? Where will your company be 5 years down the line? Secondly, I can't stress enough that starting early is crucial to a solid IP strategy. It's much easier to lay solid foundations at an early stage rather than trying to correct mistakes later on. And there's hundreds of examples of this for companies like Monzo, who didn't carry out any trademark searches and then had to go through a costly rebrand later on. Finally, when you have an IP strategy in place, write it down and document it. What are you keeping as know-how? Which steps have you taken to keep it secret? And how do you intend to identify further innovations in the future? Having a documented IP strategy demonstrates to investors that you have considered your IP strategy carefully and makes you a much more attractive investment target. So that just leaves me to say thanks a lot for listening. Please do come and find us at the GJE virtual exhibition stand. We are running free one-to-one IP clinics throughout the event to allow you to get some free initial IP advice and ask any questions that you have on IP specific to your business. So thanks again, and let's move on with the competition.
Can't hear the words.
Yeah, no sound.
%6 year-over-year demand in growth for care. Our solution is the Kepler Night Nurse, which reduces the workload of caregivers by 40% at night. How it works? There is a camera that looks like a smoke sensor. It has a small lens. It observes what is going on in the room. It transmits its video signal to a small mini computer. The mini computer does the heavy lifting in machine learning and computer vision, and it recognizes if a patient is in bed, out of bed, in the bathroom too long, leaving his room, fallen on the floor. And if so, if something goes wrong, and only if something goes wrong, we send a message to the nurse call system to get the attention of the nurse. The market size for this is gigantic. If we focus only on the elderly care, so ignoring mental care, home care, hospitals, the market size is 44 million beds worldwide. For the Netherlands, the UK, and the US only, there are 1.9 million beds, and the serviceable, attainable market is 1,900 million euros per year. Our team, we are now with 15. This is our third year. We have 7 PhDs. Team is pretty much complete, but we are actively looking for extra sales. Previous exits by team members have been to Union Park Capital and to Qualcomm, and we licensed the previous patent portfolio to Microsoft, Spotify, and RPX. Our revenue model is very simple. We have a recurring licensing model, software as a service, and we charge per video stream per month. Our key expenses, right now, they are pretty much evenly divided over 4 sources: personnel, cost of sales, hardware, and managed services. But as we will grow, the main key expenses will be the cost of sales and the cloud costs and the hardware costs. Competitive advantages. First of all, we are a university spin-off, which provides us access to talent. We raised over 4 million in funding. We have all the certifications in place to be able to process patient data. We have 2 patents awarded, and we have 8 applications pending. We collected so much training data right now that we have 1 false alarm per 186
Can you please click
days
on Studios
per patient,
and
which is
join
incredible.
main stage and
We are
mute your mic
registered
when you
as a
join.
medical device now in Europe, and we have signed our first multi-year recurring license agreement. That's their provision. Thank you very much.
Adam, if you please. You are muted, Adam.
Are we supposed to ask questions
now? You are muted, Adam. Could you please unmute and start
Allow
the
the
Q&A?
attention of the nurse. The market size for this is gigantic. If we focus only on the elderly care, ignoring mental care, home care, hospitals, the market size is 44 million beds worldwide. For the Netherlands, the UK, and the US only, there are 1.9 million beds, and the serviceable, attainable market is 1,900 million euros per year. Our team, we are now with 15. This is our third year. We have 7 PhDs.
Oh my God, Adam is killing me.
We're looking for extra sales. amazing. The AI component in it is that we have to train the computer vision machine learning to get to this result.
Cost implication on that? Is it much more expensive than the other on the market?
No, it is a lot cheaper even, because the existing domotica can be replaced. In general, there are 4 or 5 different domotica things, like bed sensors, bed mats, floor sensors, door sensors. These can all go.
Cost implication on that? Is it much more expensive than
And how difficult is it to install this in a care home? Like, how long does it take to get it set up and get them started with it?
We have a demo that we can set up within 10 minutes. In the end, the placement of the optical sensors is the most time-consuming part. So for that, for every room, this takes about 30 minutes.
And what's the biggest pushback you get when you're trying to sell this to a care home? Why do people not want to buy this? Or what are they worried about?
Yeah. So the personnel, strangely enough, is worried about losing their jobs. The nurses may not like it because they like to keep things as they are. Other than that, usually the chief financial officer is our best friend.
Presumably it integrates through an API with care planning software?
Yes, it does. We integrate with the nurse call system. Yeah.
Any issues with sort of global expansion in terms of, for example, HIPAA in the US?
What was the last question?
Any issues with regard to regulatory compliance, for example, HIPAA?
Yeah. So we have to deal with the regulations in Europe, and I think they will be slightly different in the US. But we assume that in Europe they are more strict than in the US.
I wouldn't bet on that.
No, yeah, okay. But you know, we have jumped through a number of I don't know if that is a good expression, but you know, we had to get ISO certification for the Netherlands, NEN certification. We also registered as a medical device in Europe. So you know, we can deal with that. Whatever comes up.
Okay, I believe that's probably our 2 minutes used up there, folks. Thanks very much, Harro. Nice job there. And it looks like you've achieved some phenomenal stuff there. And regardless what happens today, I'm sure that you're going to fly with that. It looks great.
Thank you, Adam. All right. Bye, everyone. Bye, judges.
Thank you.
Take care.
Bye.
Thanks very much. Okay, the next our next one up is Patch AI, I believe. Do we have the video for that or the presentation ready?
Right here, Adam. I mean, we decided to do it live anyway, so here I am, representative of Patch AI, Kumar Palanivel. So let me share my screen with you guys very fast. Okay, so I just need confirmation that everyone can see my screen.
Yeah.
Okay, perfect. So without further ado, my name is Kumar Palanivel, co-founder and the Chief Business Development Officer at Patch AI. And what we've done is we created the first virtual assistant for the purpose of patient engagement within clinical trials as well as routine care. 15 years, $2 billion. That is how long it takes to get a new drug to the market. But it's also true that a lot of evidence is needed to be generated in order to get a new drug to the market, and clinical trials need to be conducted. But the problem is clinical trials are expensive and highly inefficient. 85% of them get delayed, and 50% of patients either miss therapies or struggle to cope with all the tasks and visits that come with participating within clinical research. So evidence generation becomes an issue, and it is highly flawed. And this can have a health economic impact of up to 6 million per day, every single day for every single drug. The problem is We have instruments like this on paper being used to collect data from patients over a period of 2 years. So you can imagine a patient having to fill this out for over 700 days for 50% of trials. But then there are digital solutions on the market, but they're not a lot different because they take what's on paper and put it on a screen. No wonder patient engagement is super, super low. And while there are a lot of market leaders who manage to introduce their solutions in the market, we're trying to do something different because we envisioned a better way, because we decided to make it conversational, which is more adaptive and predictive. And eventually we try to make it more human, but also something that can be customized, which makes us much, much better in terms of project delivery compared to our competitors. So going to the solution per se, what we do is we collect behavioral data from patients and translate that into our machine learning engine to create a personalized conversational strategy to adapt to patients' daily routines and everyday needs in order to empower them to report more robust health data, which would provide real-time analytics for clinical research and doctors to make informed clinical decisions. And so to give you an example of how we do it, depending on the level of engagement, we try to adapt the tone of voice of the chatbot. If the level of engagement is high, we try to motivate the patients and give them more achievement badges, so to speak. Slightly lower, and we try to get them back on track, even though they've been doing pretty well of late. And once engagement gets really low, we try to take a more empathetic manner to how we handle patient engagement and try to push out more notifications to get the patients back on track. So PatchAI's value proposition hinges on patient engagement from clinical research all the way to clinical practice by offering a modular conversational AI platform which personalizes how data is collected from patients, thus truly embracing the doctrine of personalized medicine. So it could either be that we can help patients report symptoms in real time, but also get reminders for all the therapies that they're required to take. But also, in the wake of the COVID pandemic, we've introduced video visits so that they can engage with their healthcare professionals in real time. But most importantly, also gather important data from connected devices and wearables, and introduce elements such as gamification to improve overall patient experience. But does PatchAI really engage? Because with paper solutions, we get an average compliance of 11%. With other standard solutions, we get 80%. PatchAI produces 95% daily compliance with therapy plans, as well as daily questionnaires and diaries. And how have we proven this success so far? So our recent success story comes with Roche, where we deployed the first digital solution in Italy for all oncology patients on a nationwide level. And we also helped Novartis launch the first ever digital trial in Italy for a breakthrough therapy within neuroscience. And we want to use this momentum working with 2 of the 3 top pharma companies in the world, having generated $500,000 in revenue in 2020, to achieve more scalability in product, to go in for a Series A, but eventually the scope of becoming a digital therapeutic in the long term as well. So far, an average of 28, almost 30,000 new products per year, almost $7 billion in value. We hope to get just 80 in 5 years to meet our required targets and get 32 million in revenues. So we have a current ongoing round, which is a bridge capital before the Series A of 1.7 million, of which 100% has been committed. And we have a team of around 20 superstars comprising doctors, research nurses, and nurse directors, backed by a team of very talented business development and product development software engineers who are working tirelessly to create the best product possible. So join us today to revolutionize clinical research and care pathways through patient engagement at every step. Thank you. So I think that's 5 minutes on the dot, if I'm not mistaken. So
well done, Kumara. That's a nice presentation. It looks really interesting. I'll throw in a question to start things off. As far as engagement with your app, I mean, how much traction are you getting with that at the moment?
I mean, with the patients per se, we have about a cohort of 100 to 200 patients using the app from our first clinical trial with Novartis, which we went live earlier this year. And I'm happy to report that we have an average of daily compliance of 95% with reporting therapy intake, as well as filling out daily diaries, as well as the protocol mandated pre-oral questionnaires. And this is a small sample size, but we're trying to build upon this metrics. And also, we have 100% retention so far, especially in the wake of the COVID pandemic.
Great, thank you.
I also have a question. Kumara, congratulations for your product. Given that you are so close to the patient with what you're doing, I appreciate you have nurses as experts in your leading team. What about patients? Do you think to bring patients on your leading team as well?
Of course, it's why we actually partner with a lot of patient associations, so that for every single feature we release, we sit down with the patient experts and advocates to sort of help them, for them to help us understand if every new feature we deploy is of actual value to patients. So we conduct a lot of UATs, continuously getting feedback from patients and patient experts to ensure that we're not just a patient-centric solution on paper, but then we actually have the backing from the experts themselves in terms of what patients would love to use.
And then your second quick one, you mentioned that you would like to become a digital therapeutic. Any ideas you'd like to share with us about those plans?
Sure. So on top of this ongoing collaboration with Roche in Italy, we are trying to focus on this use case for oncology, where we realized, the purpose of the solution is to sort of personalize it to patients' needs and sort of improve their experience, and indirectly, empowering them to report more data, take their therapies on time, and trying to demonstrate an improvement in their overall clinical outcomes. So we're slowly building the clinical validation roadmap for becoming a DTX, and we planned a couple of pilots through collaborations with EID Health and other organizations to sort of do small, living test beds and demonstrate some metrics before we decide to launch the DTX program.
Can you compete with the likes of Medidata? Do you have anything that is IPable or unique that wouldn't stop them just coming in and saying, do you know what, let's personalize ourselves?
That's a great question indeed. And what we've noticed with all the market leaders is that they don't have like shrink wrapped or configurable solutions, but rather they have standard solutions that they provide to global CROs and pharma companies across the world at very high prices. So we're trying to overcome the barrier that they've experienced in Europe, especially because of the stringent regulations, and trying to use not only our local presence, but also the fact that we offer our solutions at cheaper prices, but that we're also capable of offering different modules according to the needs of every single trial. So having worked with Novartis and Roche, we're trying to do the system where we're trying to upsell through our collaborations with them and subsequent CROs to get more presence in the European market before directly jumping into the North American market, which is just swimming with sharks at the moment.
That's great. I think we're going to have to curtail it there, Kumara, but great job. Nice presentation and a really good idea as well. Thank you.
Thank you so much.
Okay, so next we have lined up Chin. Have we got Chin ready to present to us?
Hi, yes, good morning, everyone. So let me share my screen. Okay, can everyone see this okay?
Yeah.
Okay. All right, good morning, everyone. My name is Shayo Waja, not actually Shokba. I also have a twin brother who's working with us on the team, and I wasn't able to create a separate profile. And today I'm going to be telling you about CHIN, the Critical Healthcare Information Integration Network, a platform we've been working on over the past several months that we intend to be a bridge between disconnected healthcare providers and dependable medical information. So let's start with a brief hypothetical. Let's take this hypothetical community health worker who's recently trained and is now working in her area and doing rounds. She heard from a colleague about a Lassa fever outbreak that was occurring elsewhere in the country, but is yet to impact their area. And because it's not prevalent in their area and because she's completely offline, she has no access to up-to-date federal guidelines or other disease information that might be found via online resources. As she's making her rounds for that day, she comes across a patient presenting with fever, weakness, and a strange facial pain. And thinking that it might be Lassa fever, she'd like to get more current information about the disease, but has nowhere to turn. So this is a hypothetical situation that could face many real community health workers throughout the African continent. For those who don't know, community health workers are a crucial part of African health systems. It's estimated that they serve nearly 700 million people throughout the continent and often serve as the first point of entry for many people into the healthcare system by providing a wide variety of very important health interventions. Typically, when a community health worker is entering the field, they undergo a one-time training that could last on the order of weeks to months. And that's then followed by a series of intermittent, though important, refresher trainings. It's been demonstrated that in the absence of those refresher trainings, there could be issues with knowledge attrition and skill attrition. However, those refresher trainings and continually bringing in people via expenses such as transportation and meal supplies, honorariums, etc., could become quite costly. And it's been shown that with the implementation of a blended training model combining in-person and electronic training, there could be savings of up to 42% on total cost. So this is just to provide evidence that electronic medical reference tool could be both a performance enhancing and cost saving measure for these workers. However, it's not so easy to implement such an intervention in Africa, particularly in the rural parts of the continent due to low internet penetration. But we could turn to alternative connections or alternative technologies such as SIM connections, which have much higher penetrance.
So to address this problem, we made Shin, which is a free-for-use SMS messaging system that provides validated medical information on the causes, presentations, management, and associated complications for context-relevant diseases for the community health workers where they are in these rural settings. So our team synthesizes this information from internationally acclaimed online medical reference sources such as the Mayo Clinic, CDC, and WHO, as well as any local information that we get from our partners. And we put that into digestible text message format, and that can be sent to our offline community health workers. All, of course, with the goal of providing higher quality of care. So the way it works is that the user would register and then use the chatbot. The chatbot connected via Twilio accesses our backend in Firebase, and without the community health worker needing to access Wi-Fi, they can get any of the information they need that's already stored on our databases.
So evidence from a lot of previous mobile health interventions in Africa and in various other kind of resource limited settings have shown that success is really predicated upon building a sustainable financial model, even in this context of a nonprofit. So as such, we've based our model on a structure that creates value for each of the key stakeholders in the process. So private and corporate donors have improved marketability in these lower resource settings through a tax-exempt donation process. Mobile network operators can expand their network or their market reach through ensuring more continuous service engagement from customers who might be less, I guess, want to try to engage with such services. Governments have an investment vehicle that's aligned with their national health priorities. And most importantly, community health workers have access to a service that can lead to better health for those around them. So to begin the validation of our platform, we are piloting Chin in collaboration with Rural Health Mission Nigeria. They're an NGO based in northern Nigeria that helps train hundreds of community health workers and deploys them throughout rural areas in the region. So starting next week, actually, we'll begin onboarding health workers onto our platform and investigating the impact that having ready access to reference information is having on their ability to provide the highest quality of care using certain survey tools and assessment metrics that we've designed. So we are a team of Africans with a vested interest in supporting African health systems. We have a variety of technical expertise, clinical acumen, and a real passion for creating change in the continent that's driven us through this pursuit so far. And we're excited to see how Giant Health can possibly play a role in helping us go further along our journey. Thank you, guys.
Oh, sorry, I better unmute myself. Thanks for that presentation. Any questions, folks?
I'd like to, well, first of all, congratulations because it's a great and much needed solution. Sometimes we forget that SMS and other more frugal tools are what some geographies need. I have a question regarding the business model. Initially, it's free for use, of course, for the health workers. And at the moment, it's very donor or grant focused, from MNOs or other organizations. But who do you foresee paying for the solution moving forward in the next stage?
Yeah, there's kind of two types of, I guess, approaches that have worked for other types of similar interventions in the past. One is kind of more of a fee-for-service type model, where the end user is perhaps like a little bit more higher resource, like rather than a community health worker, for example, would be like a practicing physician or somebody with a little bit more willingness to invest financially in these kind of performance improving tools. But in the context of a community health worker who typically is just someone from the community who volunteers to provide these health services to people around them, they will have less of an incentive to like spend their own resources on something like this. So we think that government collaborations will probably be the kind of path to deployment that'll give us the most, or the position us the best to kind of have a sustainable funding source for the, I guess, the costs related to the platform.
So that implies that you have no fixed price revenue model, and with that in turn implies that you're looking to capture data and sell it, and that's your primary revenue source. Is that true or not?
Sorry, you're a little faint. I didn't quite. Oh, sorry. Go ahead.
Yeah, that is not true. We currently have no plans on selling any of the data that we're collecting. The only data that may be publicized would be from an IRB process that we would go through in order to validate that our methods are actually effective.
So you've been negotiating with each different potential client with regard to the pricing.
Yeah.
And how accurate is it? So like, what are the chances that somebody sends an SMS to get some information and it returns something completely random, well, not completely random, but like not what they're looking for? How have you kind of improved the accuracy of the product?
Yeah, so go ahead.
Oh, I was just going to start by saying, so I think we've dealt with a lot of the potential accuracy issues by, rather than trying to collect information from ourselves and like generating it ourselves, instead using other already established sources to create the summaries that we're sending. So Ebube mentioned, for example, referencing sources from the Mayo Clinic, WHO, CDC, and other places that like offer information that's well validated and well sourced. So we're not necessarily putting ourselves in this process by being our own knowledge creators.
Yes. Anytime that we give information to an end user, it's also sent with the source. Now, that source is a shortened link, and we don't expect them to necessarily access that source in real time, given the issue is Wi-Fi. But we always send out that information as well.
Great, thanks.
Yeah.
You mentioned a few revenue streams, so outside governmental organizations. You mentioned private organizations as well. Could you clarify this?
Sorry, you mentioned what type of organizations?
Governmental, like public health authorities.
Yes.
So aside from those, you mentioned other streams as well. Could you clarify on the other streams of revenue?
Besides like public and private stakeholders, or besides?
On the private stakeholders.
Okay. Yeah, so I mean, the two kind of like parties within the private sphere that I was considering are primarily like corporations with healthcare kind of objective and interest, and then also the mobile network operators who oftentimes for these types of health interventions will provide funding to some extent in order to increase the number of customers who are then kind of providing an additional kind of revenue stream for the mobile network operator themselves. So in return for kind of spreading their or largening their customer pool by reaching these perhaps harder to reach markets, the operators themselves will help support your initiative, or in this case, our mobile health initiative.
I understand. Thank you. And do you have any of these kind of private clients, or do you have any feedback from them?
Sorry, I'm having a little bit of trouble hearing you.
Do you have any feedback from the private clients?
At the moment, no. It's pretty much just kind of preliminary conversations that we've had with a number of different stakeholders to get a sense of how we can create this kind of sustainable model, but we don't have any sort of kind of specifics laid out at the moment.
That's great. Cheers, guys. We're going to have to move on now, but really well done. I mean, that's really ambitious what you're up to there, and obviously much needed. So thanks very much. Next up is Easy. Do we have Easy?
Yes.
Ready and raring to go?
Ready to go. Absolutely.
I shall mute my...
I'm assuming you said you were putting yourself on mute, which is the phrase of 2020. Anyway, great to have the opportunity today to share my story. My name is Yves Brevoort. I'm the founder and CEO of Easy. And this story started some 4.5 years ago when I had a personal moment of clarity, that moment that you realize and see all things very clearly. And for me, it was when I learned that if you really want to make a change or have big impact, you have to be willing to leave everything that you currently am or have behind. And that resonated with myself. So I quit my job. I was working at a large pharmaceutical company at the time, which is also pretty famous today. They're called Pfizer. And I jumped into this adventure that brought me here today with you. And this adventure is all about vision. And vision in the sense of seeing clearly. I don't know if you can see my slides, but I will advance them. If I don't hear any no's, then I'm assuming that you can see it because I can't see myself anymore. Vision. And vision is totally outdated in the way we actually monitor it and treat it. And the world is really moving forward pretty fast, which we, of course, can see today because we are having a conference even completely virtual. And that requires a new approach. And we are this new approach. We have developed a clinically proven online eye exam, which is really a medical grade technology. So it's a medical device that allows patients and consumers to test their eyes at home, and for vision providers to actually monitor their patients remotely and perform telemedicine. So how does it work? The only thing you need is actually all the things that you have already in front of you. A laptop and a smartphone, which I'm assuming you also have, and 3 meters or 10 feet of space. And then during the test, your remote control actually functions as your phone functions as a remote control. And on the screen, images are displayed just like going to a regular eye test. The webcam that monitors the user during the test, so making sure that she is at the right distance, and the light conditions in the room are taken into account. And then after the test, the results are sent to one of our optometrists who validates the results and can issue a prescription for eyewear. That can be contacts or glasses, or the results are sent to an ophthalmologist in the course of clinical practice. So what makes us unique? Actually, 3 things. First, the state-of-the-art technology. So we use the latest and greatest in tech that allows us to do an eye test reliably on any device through web-based technology. So we can be sure that people do a quality eye test. It doesn't matter what the laptop or the smartphone functionality is. It's infinitely scalable. Even today, we can handle millions of users, and it's easy to use. Our users rate the experience of the test with a 4.3 out of 5. The second is probably even more important, is it's a quality assured medical device. So we are CE certified, but also have a quality management system by ISO. And we are clinically proven in terms of our accuracy. And then in terms of traction, this year was an amazing year for us because we could actually add a lot of value with our technology. We helped hospitals performing remote eye tests, especially when they were in lockdown. And in this way, we definitely made a lot of steps towards our vision, which is helping people with poor vision, which are 4.3 billion people around the world, to solve their problem. When it comes to the traction, we can also split it in two ways. We are helping eyewear companies to do a digital transformation, and we are partnering now with the biggest retail company in the world, Grand Vision, the biggest e-commerce player in Europe, Mr. Specs, the fastest growing omni-channel brand, Ace & Tate, and the largest health insurance company in the Netherlands. In ophthalmology, we are starting a clinical trial for cataract patients in January with 5 of the leading centers in the Netherlands, Germany, and Austria. But we have also started clinical trials in uveitis, children with myopia progression, and amblyopia. So super proud where we are today. Because we are definitely making some impact on our mission, which is to improve the lives of billions of people around the world with easy access to better vision and eye care. Thank you.
Great job. Thanks very much. Okay, well, I'll kick it off then. I mean, it looks like there's a lot of traction. The question that I have is there any equipment needed by the users? Is it just a laptop? Do they just flip open their laptop and then they have access to this? Is that how it operates?
That's exactly how it operates. Well, you need also a smartphone because the test will instruct you to go to a 3-meter distance, and you have to be able to operate the test from there. But that's the only thing you need: a laptop, a smartphone, and internet access.
Great.
So you mentioned that you had a great year, with some good implementations. Congrats, it looks great. Could you give us some of the feedback? Did you have any hiccups?
Of course, we always have hiccups. I think our biggest problem at the moment is that we are a software medical device, so we have quality and reliability high in our priority list, and we can help people with refractive errors up to -3.5. So that's only 25% of the population, which is still a great solution, but we are more ambitious than that. So next year we want to extend the range to also include higher myopic patients and also move into the elderly population where people above 45 that have presbyopia can also start doing our test.
So you're still investing heavily in research and development, is that correct?
That is correct.
When I go to the optician, they do a range of tests, and many of those seem physical to me, and some seem quite sophisticated. Is your system literally replacing all of the tests, or is it a reduced suite of tests?
Exactly. You already gave your answer yourself. So what we do is refraction and visual acuity. So we measure what is the quality of someone's sight and what is the strength that you need for glasses or contacts. We are no comprehensive eye health exam. So if you have health problems, then we of course ask this, and we also are able to detect this in some cases, and then we refer the user or the patients to the right care.
So you're not replacing the visit to the optician, you're just speeding up the initial process.
Both. We also replacing some of the visits when it comes to, for example, just reordering a pair of glasses. Then we just make sure that you have the right prescription, because it can change from prescription to prescription. And then if there are no healthcare problems, then you can order your glasses or contacts online.
Can I have a quick question? Since you only do triage or digital front door activities, how much would you have to integrate into the clinical systems on the other end, and what is the pathway to get there?
Yes, very good question. So this is also, in terms of hiccups, maybe another bottleneck that we are facing, because we're a very small company, of course, and hospitals are pretty big and have a lot of other priorities. So one way that we do this, we teamed up with an electronic healthcare record provider for ophthalmology clinics here in the Netherlands, and they integrated it into their system and then sell it as a complete package to eye clinics. That's one way to do it. The other way is also we work together with health insurance companies and see if they can help us speed up digitalization in the hospital and making this implementation go smoother. Because we do think there's quite a big value add. We can save hospital visits. That's a saving of 200 to 250 euros per visit. And for cataract patients alone, we expected we can halve the number of required visits.
That's great. Thanks very much. Nice presentation. Great idea as well. So next in line, we've got Skillfield Solutions. Do we have them ready and raring to go?
Yes, we're ready, and I believe we are raring to go. Good morning.
Fantastic. Ready when you are.
And I have little time for anything else. Then I fall in. To access care, I must go to a hospital, wait in line for about an hour to see a medical doctor. That affects my working hours. There are more medical doctors out there. However, with 40% of them unemployed, I must make do with what I find in the hospital. I have to visit a particular facility where my medical records are stored because no other facilities has them. This scenario illustrates the basic challenges faced by people in many developing countries in accessing medical care. Excessive waiting times, inadequate health personnel, and poor access to medical records. And this is how we are using Meditech to resolve them. Meditech, as a healthcare mobile platform, efficiently schedules meetings between clients and medical personnel, eliminating waiting times. The platform collects and validates the medical licenses of healthcare personnel to ensure that there are more of them available to provide health services, hence creating jobs. And finally, it provides an online database of health and treatment history that allows me to be treated anywhere by any health personnel because I have my medical records on my electronic device, hence providing flexible medical care. This is how it works. The client simply signs into a mobile application, fills out a short inquiry form, accepts the cost of treatment, and a medical doctor is sent to his location to provide treatment. Our target are the youth in urban settlements. We are looking at people between the ages of 25 and 65 years, because these people make up the bulk of those in the formal sector and are more open to the use of technology and innovations like this. Our team consists of people with experiences in project management, medical advisors, software designers, human resource personnel, program support, and business advisory. Our revenue model is charging commissions on services, service payments that have been made to medical personnel on the platform, and charges for account registrations. We will establish partnerships with licensing bodies to validate licenses of medical personnel, engage indigenous healthcare providers to provide care and treatment services at affordable prices. In partnership, we are going to be in partnership with healthcare insurance companies at some point in the future. We also expect to explore conversion of individuals in the database Meditech held by these companies. Then we will use a mix of digital and traditional campaigns to create knowledge about demand for the product. Our key expenses will cover logistics, application development, licensing, and staffing. In conclusion, Meditech is going to provide 3 basic opportunities. 1 is efficient treatment timing. 2, jobs for healthcare personnel. And 3, better access to data for treatment and patient monitoring. We have a competitive advantage over telemedicine because we can provide physical diagnostics and treatment. Our competitive advantage over visiting physical hospitals is improved data access and creating distance between possibly infectious patients. I believe that with remote services on the increase, Meditech is the healthcare option of the future. Thank you.
Thank you. Well done. I guess my first question is your rollout strategy. What is the rollout strategy, and is there many users on board at the moment?
Hi, Adam. At this moment, we are at the idea stage. We are just completing the building of the prototype. As a matter of fact, we had to put some of the work that we're putting in right now on hold just to properly answer questions as we stand. So we hope to be finishing the prototype before the first quarter of next year, following which we'll be carrying out some market research and market survey and testing of the product within the first and the second quarter of next year. We'll continue with that to take us to the end of next year. Then we can see, we'll take back the feedback that we get and we'll produce a definitive product by the end of next year. We're hoping to launch and scale up within certain communities, especially in Nigeria, because we're Nigerian based, going for over the course of 2022. So yeah, that's kind of our rollout strategy.
Can I ask, what is the revenue model? Is it commission or is it subscription, or what's the model? Where's the money come from? Sorry, is my mic okay?
Hi, sorry, my internet connection seems to be really poor right now.
Sorry, did you other guys hear me?
Yeah, I can hear you.
Yeah, okay.
Sorry, my internet connection was just poor over the last few 20, 30 seconds.
The question very simply was, as they say in the movies, show me the money. Where do you, what's the revenue? Is it commission or subscription or pay-per-click or what?
The revenue model is supposed to be commissions that will be charged on payments made to medical personnel.
Okay.
Yeah, but we're looking at, in the future, one of the things that is growing in developing markets, especially in Africa, which I know for healthcare financing in Africa, is healthcare insurance. Now, it's a very vast, important field that is not being fully explored. and we're seeing this as an opportunity to explore the essentially the opportunities for healthcare financing in Africa. As of today, less than 20% of people who live in Nigeria, for example, or as a matter of fact, in sub-Saharan Africa, have access to healthcare insurance. Really because of geographic locations, really because of other small challenges that can be overcome. We're hoping to use the tech systems to overcome these barriers. So this is the first phase that we're hoping to expand on in future.
I got a good question on the go-to-market model, if I may. And I appreciate that you are still in the polling state, but typically your solution will be focused on, young or well-to-do population from big city centers like Abuja.
Yeah.
But obviously in Nigeria, there is a huge capacity gap. There are not enough doctors or clinicians for the population. So I was wondering if you are thinking of pivoting for the rest of the country in the future with services that would be web-based or as a proper telehealth platform because of that. Instead of making the appointments with real doctors, maybe triaging or providing some services for those places where there are not doctors to see.
Yes, it does seem like if I'm saying yes to everything but yes, it's something that we thought about. It's something that is in development stages. We understand that there might be burnout because really most solutions in Nigeria are focused at the same people, right? So what we're looking at is that in long term, when we're able to consolidate, then we can use it as a pivot to enter into other markets. We can go to remote communities, for example, in Cameroon, and provide them healthcare services. It might not be the same model that we're using today, but down the line in the future, when we've explored the market, what is most important to us is knowing that knowing what is on ground, because there's a large paucity of data. There's almost no data anywhere. So we want to know what is happening, get a true representation of what is happening before we pile things on the present strategy. We can use this as a foundation, then we can add on insurance schemes, then we can add on community medicine programs that amplify the small number of medical practitioners that we have to reach hard-to-reach areas using tech solutions. So yes, it's something that we have thought of.
That's great. Thanks, David. We're going to have to move on now. We've got a talk, I think, by Paul Gordon next as an interlude, while we have a little chat about the process so far.
Okay.
Michael was my friend for 20 years, and this is my story about the special relationship that he and I had. When we first met, it was through our kids. Our kids went to the same school. We've got 3 children, more or less exactly the same age, and our wives have become great friends. And certainly for the first couple of years of our friendship, it was mainly around the subject of football and politics and increasingly business. Michael at the time was a licensing agent, and a really good one, and was doing some great work for some global brands, Juventus. On the toy side, he did a lot of work for Disney and McDonald's, and was really, really exceptionally good at it, and would have created a phenomenal global licensing business. But illness was always there, and often got in the way of some of the great opportunities that Michael had presented to him. But what it did do, this particular phase of his life, taught him about how you manufacture, because he manufactured toys in China. And of course, as we know, that was particularly useful in the years to come. As I say, Michael was often ill, and our friendship was typified by quite often him being around and then quite often not being around. So that culminated in his long period of hospitalisation at UCH, and I'd go and see him 3 or 4 times a week, and we'd chat. And we talked about business, and we said, wouldn't it be great if we could end up doing something together? He was always pretty prophetic in his forecasting. Michael's transplant changed him. It was almost like a sense that he needed to do something meaningful with his life, and he talked about how, rather like Holocaust survivors who often feel that they were spared to do something, he felt that he was spared to do something, and that was the genesis for 11 Health. So as we all know, he started 11 Health, or what became 11 Health, from his hospital bed by hacking a sensor to essentially turn dumb medical bags that hadn't changed for 40 years into smart medical bags. As you know, as I think most people seeing this video will know, that led to some investment in the UK. But the UK was tough, it was slow, the NHS didn't really understand the opportunities presented. So Michael thought, wouldn't it be great to go and do something in the US to see if the business could scale more quickly, more rapidly there. And that's what he did. I mean, not many people do that, but Michael did it. He took the business to the US, I think we all know what happened. But I think bits perhaps that aren't known by everybody who's going to see this video are what happened in between. In the 5 years from Michael being pre-transplant to starting the business and for the business to begin to really motor, Michael struggled financially. And a lot of people helped him, and he knew exactly who they were and had it all written down, and was hoping that one day 11 Health would be big enough for him to be able to thank everybody who helped and support him. And he would never have forgotten that. He always knew who helped him on the way. From a personal perspective, in that time, Michael also taught my son Jack's bar mitzvah, and then the result of that is Jack and Michael formed this incredibly tight bond. Michael asked me to join him in the business in July 2019, and Nicole, myself, and Jack moved over, the plan was that we would spend minimum 2 years together. Literally, we were 2 streets away. We'd see each other every day, and we'd have a great personal and professional experience helping grow and scale 11 Health and helping realise the ambitions that Michael had for the business. It wasn't to be. Michael was sick for most of that time, and although I saw him in the evenings and many visits to see him in LA in hospital, we weren't able to spend that much time in the business together. I think that what I'd say a little bit about the business moving forward is that he's sown the seeds of what's going to be a fantastic business, a business that's about transforming patient care from the inside out, from the patient's needs and out. My job is to be a part of that, to continue to be a part of that, to be part of the leadership of the business that's driving that vision forward. I take it terribly seriously. I often feel that Michael's on my shoulder, telling me what he wants me to do, and because we had such a great tight bond, it's kind of strange, really, and surreal. But I can sense it, and that's what we're about. We're about bringing together the vision that Michael had for the business. The brand promise that he and I wrote together was one patient at a time. One patient at a time is the articulation of why we exist, to do what we do, which is to transform healthcare. And I take terribly seriously my responsibilities to the business, and in terms of honouring his legacy. He was rather an extraordinary man. In some of the press releases around his passing, I used an expression which seemed to be quite well liked, which is, he was the smallest giant I knew. I think we all know what that means, but he truly was. He was in some ways a genius, an overused term perhaps, but he really was a genius. Certainly from my perspective, my job is to kind of honour that, and to make sure that we at 11 Health, and me as a lifelong friend, never lose sight of what we exist to do, which is to transform healthcare, particularly the area of healthcare that we're in, because he never got the opportunity to bring that to fruition. Thank you.
Hi, I'm John Williams. I'm director at Granted Consultancy, and we're one of the sponsors for this year's Beanstalks Pitch Fest event at Giant Health. This year, we're providing 3 levels of prizes to applicants and entrants to the PitchFest event. All entrants to the PitchFest will get our guide to the grant funding landscape, and that's tailored to the healthcare funding landscape in the UK. And we'll use our expertise at Granted Consultancy, informed in that report, informed in that guide that you'll get as an entrant to the competition, to give you an idea of the best places to look for funding, the best time to look for funding, and the key funders and the key dimensions of those funders, and also an idea of the current opportunities that are available. So that's the every entrant that applies to the PitchFest will get that from Granted Consultancy, and that will go to everyone post event. For all finalists, so everyone invited to pitch on the day at the Giant Health event, we're providing another guide to all finalists, and that will have all of our top tips for, in particular, for grant funding. So it'll be a guide to key sources. It's also a guide to go through how to secure funding, some ideas of how, over the years at Granted, how we secured grant funding, non-dilutive funding around innovation, and particularly around healthcare for our clients, and how you might be able to benefit from that. So that's something that we're putting into the pack for all the finalists for the PitchFest event. Finally, we're providing for the 3 finalists, the 3 Beanstalks finalists of the event, providing a tailored grant scope. So for those, this is what we do with all of our clients at Granted Consultancy, is we'll essentially mimic the initial engagement, but do so on a free of charge basis for those 3 finalists, where we'll provide a tailored grant scope. And what that means is we'll do a matching process between the funding needs of those 3 finalists and against the current funding landscape, the current funding needs, and the profile, and try and match that up to try and basically develop a report that enables you to best identify the funding opportunities that are best suited to you at this moment in time. And in addition to that, as a follow-up, post that scoping exercise, we'll do a one-to-one. So all the finalists, sorry, all the 3 finalists from the PitchFest event will get a one-to-one with one of our senior team at Granted to go through that, to make sure that we've understood the needs correctly, and to play back and look at that.
We live in a society that is becoming increasingly more conscious of what we eat and how we maintain a healthy lifestyle. The problem is we're bombarded with so many fitness programs, from apps and diets and books, and they don't always guarantee results. We are all unique individuals, so we have to find out what works well for us. This is where DNA Pal comes in. We've created a solution to provide reliable lifestyle advice to help you with your nutrition, your lifestyle, your supplements, for you and your DNA and for your genetics. So we test for the genes we need, and from the analysis, you received complete, personal, tailored advice to suit you and nobody else.
I'm Kate Scott. I'm a registered nutritional therapist, nutrigenetics specialist, and co-founder of DNA Pal. When Vicky first approached me with the idea of DNA Pal, I didn't hesitate. I'd been developing and using DNA-based diet and lifestyle plans for a few years already, and I saw the advantage immediately of being able to deliver these in a more dynamic digital way. We began designing the app, which includes a proprietary algorithm that calculates the exact diet and lifestyle recommendations for an individual based on a combination between their unique DNA and their current diet, lifestyle, and health factors like hours of sleep, alcohol intake, age, etc. This is a really exciting time because our company sits within 3 major growing trend areas: the UK health tech market, which is the 2nd fastest growing tech sector in the UK, the global wellness market, which is a really broad market, but healthy eating alone is worth over $700 billion US, and the direct-to-consumer genetic testing market, which is set to exceed $3.4 billion by 2028. Our target market is health-conscious adults between 35 and 65, with a significant bias towards women. This market in the UK alone is about 46 million people, We can support this audience throughout their various life stages by becoming their pal for life. Although your DNA doesn't change, people's lives and needs do. Our app also supports DNA data from two of the world's largest direct-to-consumer DNA testing providers, Ancestry.com and 23andMe, giving us a combined global addressable market of about 27 million users. We also offer our own DNA tests, which cover over 700,000 genetic data points, and we guarantee customers complete data protection. We destroy samples after processing, and we will never sell DNA data.
Our platform is simple. Users purchase our DNA test kits. We get a swab of their saliva, and then we send it off. We analyze their DNA and provide the results through the app. There's total science behind it. It's no secret that the combination between our genes and lifestyle dictates our health. Our aim is to help you define attainable goals and reach them. With regards to our team, we've managed to attract an amazing array of talent across the core disciplines.
Our revenue model is split over 6 different streams. We have our DNA tests, then app subscriptions and in-app purchases for things such as the personalized meal plans, the one-to-one online nutrition consults. We also plan to partner with retailers like supplement retailers via our online store, and also the outcomes data that we'll be generating when looking at whether the users are improving their health through the recommendations that we provide.
Investment in our company will broadly be spent in line with our overall OPEX, 40% on the platform and the development of the tech, 30% on talent and people, and 30% on our marketing. Our competitive advantages are evident, not least that we start with real authority on the subject matter, as we're both trained nutritional therapists, and we see daily in clinic that everyone is completely unique and different, and what works for one doesn't work for the other. We're completely evidence-based, and within the app we have a balance of nutritional advice for the layman, but for the science geeks we provide the latest research on genes, so something for everyone.
To us, this isn't just a business. We are genuinely excited at how many people we can help through our advice and suggestions with this app. Technology and people's willingness to interface with technology now allows, perhaps for the first time, the support of this nature at a vast scale.
Just to round off, Kate and I work really well together. She's the science geek and I'm the power part of the app, and it's a really lovely balance. And we just wanted to say thank you, Giants, for inviting us, and thank you, panel, for listening. We look forward to the Q&A in a few moments. Thanks.
Things off. I've certainly got a few questions, but I shall hold back for now.
I'll dive in by asking, there's so much suspicion with regard to the science around DNA. I mean, it's so easy to say, we've done a test, send us the money, here's your results, and what do you do? How do you prove that there is some real valid science going on that will have real personal impact?
So I'll answer that, since that's my field of expertise. I've been doing research into nutrigenomics for about 5 years now. And what we've decided to do within the actual app is to have a place. We know that it's not going to be interesting for everybody, and it is quite heavy reading to look into the studies behind the genes and the impact. But we've got a kind of a nerd area for advanced reading, where we link all of the research papers that are behind every single claim that we're making, every gene that we've included.
You sort of need a major nutritional partner, don't you, who does the work, or at least validates it for you. Do you have anyone lined up for that?
Well, Vicky and I are both trained nutritional therapists. We're now bringing a medical doctor on board to try and raise the bar in that terms. But open to suggestions.
Hi, I'd like to ask you about the differentiating part of your product? Because there's quite a lot of nutrigenomics at the moment on the market.
Yep.
And it's a double question. I mean, how do you differentiate yourself in a very busy market? And are you going to expand, let's say, into metabolomics or other areas to offer a more premium
Yeah.
offering?
Okay, so again, I'll take that. I think a lot of the companies that are currently on the market are delivering the DNA interpretation in a much more static way. So a lot of companies just do the PDF reporting. There are a few kind of interactive apps out there, but again, most of them really just give this is your genetic predisposition, and that's the information. We try to take it further by doing okay, but so what do I do now? So we really want to handhold people, because Vicky and I have actual clinical experience with knowing the kind of interventions to put in place, but also the fact that people are often not compliant, or don't, they want to be compliant, but they don't know the exact steps that they need to take in order to turn their health around. So it's about giving very, very relatable, easy information based on the DNA and an answer to kind of a more personalized question that we put together to be able to make it really easy and accessible for people to make those changes. And that's also where we brought in the gamification, because we want to make it fun for people. It can be, it's quite dry knowledge in some ways. So we're trying to make it a bit fun and exciting, and with the hand holding. So if it comes to asking people to cut down their caffeine, or drinking more cups of water, or getting more hours of sleep, we don't just say that, we guide them as to how to do that. We give them little reminders. We might show them kind of nice things that they can use as replacements, really making it relatable and easy for people.
Yeah, and I think sharing top tips, recipes, things that we know work in clinic on that one-to-one basis. And because we do work a lot on a one-to-one basis with clients, and I have a clinic in Harley Street, we see what works and what doesn't. And one thing we really see is we see that everybody is completely unique. And a supplement that we might suggest to one person, we also see that doesn't necessarily suit the next person. So for us, using the genetics part to really recognize the individuality and uniqueness of every person, and working with their uniqueness, and using our skills, like Kate said, our skills already in clinic, which we know what works and what doesn't work. And we see huge improvements. And not only that, where DNA Pal came from was it changed my life so much doing genetic testing. And it was me stood in Tesco's one day when I had all these PDF reports, and I was stood in the vegetable aisle, and I just went, I don't care about the reports. I just want someone to tell me what to eat for my genetics to make my me healthier or better. And that's when I phoned Kate, because Kate and I had studied together. And I went into cancer, and Kate went into nutrigenomics. And I said, look, we've got the name. Let's do the where now, how to do it, how to make those changes. And that's where the challenges have come in, because the gamification means that we can keep retention. We can actually help people make those changes and support them on a daily basis. We also have the ability to click through to one-to-one and pay for consultations, so they can speak to real people that are trained at our level. So again, it's not just all tech, because some people don't like bots and tech, and some people want just a real person at times. So all of that is included as well into the app.
I think that's actually another differentiator.
That's a fairly comprehensive answer. I'm going to have to curtail you now, ladies, because we've run out of time on the Q&A.
Oh, sorry.
But yeah, thank you for that very detailed explanation. And great presentation too. Thank you.
Glad you enjoyed it. And lovely to meet you all.
Likewise. Well done. Well done.
Thank you.
Okay,
Right,
next
and I
I believe
understand.
we've got Globe Fox Health up next.
And clearly communicating what's going on when we become ill. But that isn't always possible. Most of the 500,000 plus people affected by long COVID have no way to recognize, record, and report the full range of their symptoms and concerns. Current limited medical frameworks are getting in the way, and diagnosing the individual symptoms and syndromes isn't really enough. Some symptoms of long COVID are obvious. yet others vary widely. They appear to be autoimmune, autonomic, or relate to post-viral syndromes. There's an emerging link to conditions like mast cell activation disorder and ME. I've been living with mast cell activation disorder for a decade now, and for those like me, such medical exclusions are not a new problem. In the UK alone, 70,000 plus people risk poor health and outcomes due to under-recognized autoimmunity, dysautonomia, and hidden disabilities. Another 2.5 million more have unaddressed comorbidities or complex issues. That's 30 million people across Europe and an estimated billion people worldwide. Up to now, significant cognitive, cultural, and all kinds of practical issues have combined with bias and exclusions to hide the problem and prevent the scale of it from becoming fully apparent. Missed diagnosis and misdiagnosis cost the NHS £4.3 billion in 2013, plus the loss in productivity and increased costs to the state. The incalculable cost of the COVID crisis has further highlighted these issues and the urgent critical need for action. The 43 new long COVID centres are most welcome, yet current indications are that they will not have a deep enough understanding or provided with the richness of data that they need, greatly limiting their value. And what's to be done for those others who are still being left out? 5 years ago, we began to use our lived experience to research and develop tools to help those like us with hidden, complex disorders and conditions to better identify, track, and share our symptoms and concerns. Our first product is a screening questionnaire designed to help everyone uncover critical complex health issues, including those seen with post-COVID. Responses to our 200 questions are used to build indicative charts and dashboards that people share with their GP, nurse, or care provider to aid further referrals and diagnosis. The information and insights we help people gather now will help everyone identify patterns and insights that are currently being missed, enable easier interpretation of symptoms now, and facilitate better diagnosis in the future. Even with vaccines on the horizon, we are all being asked to assess and manage our well-being and health from home. Many of us will need remote or family support, especially if we have learning disabilities and differences or cognitive issues. So our tailored support will ensure that everyone can participate and get the most out of doing so. These questions will also help mitigate the current lack and predicted ongoing shortage of suitable medical services, tests, and diagnostics. But for many of the conditions we're looking at, the current tests are often misleading or the problems don't show up in expected ways. Uncovering this missing, meaningful data within the context of our framework means that we can finally build much-needed indicative and pre-diagnostic tools and establish better pathways. Without these, our future machine learning and AI-driven tools will remain biased and ineffective. Over the past year, our team has applied their extensive expertise to refine our service and proposition and ensure that this best meets critical clinical and social need. Our service delivery platform and proprietary symptom framework are now going through the last stages of user testing before we prepare our pilot services. We now need to secure our next stage funding to help us refine our services further and deliver our much-needed video and in-person support programs. We hope you will take this opportunity to help us help everyone get and share a better picture of their health and to understand more about what they will need to do to stay safe and well at this time and in the future.
Thank you. Okay, Q&A time. Well, if nobody else is stepping up, then I shall step in. My main question here is to do with the with people actually filling it in. That looked like a very detailed form, about 200 questions, and I'm guessing that a lot of your potential audience are elderly. So from a practical point of view, have you tested this at all? Have you had any insight as to whether people actually will fill it in such a detailed form with people actually
that's a
filling
very
it in?
important question, and it's actually one that we asked at a very early stage, and this is why we have support built in. So it absolutely, having this number of questions is incredibly challenging, and we've had the convention in digital healthcare is that you shouldn't ask that many questions at once. However, unless you do so, you don't get a complete picture. And supporting people to be asked that question, you could break it up into different sessions if you like. Our platform supports that. But asking all of the questions at once also encourages people to think in a more systemic way about their health and what they're experiencing. So this is not something that people would necessarily do every single day, unless there was a real clinical need to do so. But it is the comprehensive glue that could hold a lot of other things together. And absolutely, support is critical. And understanding that support, what people with cognitive impairments might need, what people who are neurodivergent like myself would need. I think, you know, the COVID era has taught us that support, you know, that you can build the best products and the best tools, but people actually need a lot of help and support and explanation to be able to use them properly. So that's absolutely built in from the beginning. And the first ever user was my father, who had severe cognitive impairments due to autoimmune, and he actually taught me what was possible. And we do need to do a lot more testing. You're absolutely right, and we look forward to doing so.
Thank you.
I actually have a question as well. Congratulations, I think is a very good idea, and we are missing real life data about many of these problems. But to my understanding, you are designing sets of questions based on a particular problem. So you cannot have like a set for all the problems. That's one question. And then second, it wasn't very clear if you have deployed at the moment your product.
Okay, so to answer your first question, the questions are actually really quite broad, because what people can experience with autoimmune and with autonomic disorders and with hidden disabilities is incredibly broad. So we cover quite a few physical symptoms, but also what people are experiencing in cognitive and social functioning. And it also incorporates a kind of body scan, really, but what people are experiencing. So it complements other tests. And we have, in actual fact, we have our own platform that we're building because we have development skills in-house. I've pretty much built most of it myself to bring us to this prototype stage. And although we do have some minor technical challenges, we've had people using it for the past 3 or 4 months on a sort of path-finding basis. So we have our platform. It's not an app, it's a mobile accessible website, but that allows us to be able to iterate our design and to be very, very user-focused, user-reactive, and to adapt as we go along, which is very, very difficult and expensive to do once you've moved to apps.
Great. And okay, Simon, you need to take yourself off mute, fella. Simon, you're on.
Yeah, thank you. Would it not be better to have the engagement process driven by voice as opposed to the conventional?
That is something that we're exploring. We've also looked at haptics to help prompt people to look at certain parts of their bodies at various times. We're really, really interested in what novel interfaces that we can use, especially for people who have sensory impairments and who might otherwise struggle they might have poor proprioception or interoception. So whatever can prompt people, and voice is a very, very powerful prompt. So thank you for reminding us of that.
That's great. Time for one more question, if anybody has one, a really pressing one. I've certainly got another one if no one does, but I shall give the opportunity for someone else to ask.
I have a question. Is in one of your you mentioned that you are going to do pre-diagnostic. Is the pathway you're looking at the moment, is it meant to augment the GP at the moment or to replace it in the future?
Very much to augment right now, but the insights and the models that we're building can be used to develop automated systems in the future. But one of the things that we're really clear on is the value that clinicians' observations bring, whether they're doctors, clinic nurses, all sorts of practitioners, which I actually think is hugely under-recognized. So we very much see ourselves as supportive technology rather than disruptive, but the data that we gather is going to be absolutely critical to make sure that where you can't have in-person services, either through economic or practical means, that whatever is delivered is as good as you can get.
That's wonderful. Thanks very much. And really good idea.
Thank you very much. It's come out of very, very deep critical necessity, but it's a real privilege to be working in this area.
I can certainly see from having worked in the frontline medical and understand the doctor's problem that this is a problem that needs to be solved. And yeah, it's great that you're getting some sort of innovations to help out in that area. So really well done.
Thank you very much.
And next up, we've got Nevis Q.
Yes, hello everybody from Germany.
Great.
So I will share just my screen. Okay. So can you see my screen? So, yep. So do you see this old lady?
No, we don't see the screen yet.
So next try.
Yep, for me.
Sorted. That's great.
Okay. So I'm very happy that we can present our company Nevis Q with our brand Nevis Cura here today. My name is Christian Kind. I am one of the managing directors of this startup. And we were established in 2016. We are a team of 16 people at the moment, based in the western part of Germany. And we want to make sure to give room for humanity, room for security for everybody, which means that whenever somebody needs special security or humanity, we want to help there with technology. And our special focus is on elderly people. What does that mean? For example, we developed a smart bed sensor, which you can easily attach to the bed. And for example, when somebody wants to get up from the bed and you know this person is easily to fall, then you can get alerted and then you can help this person on the way to the bathroom, for example. But you may also see if there are changes in the bed exit behavior throughout the time, or you might see that maybe a person is needing more time to get up from the bed in the last days, which means that maybe the person get more frail, for example. And as you see, the sensor, which can also be like brown, for example, looking like the bed, is very discreet on the one hand, still looking quite good. But you may also use this technology, for example, just a few centimeters over the ground. And when you use this technology, you might detect falls, for example, within seconds. And as you see, again, the sensor is very discreet and not really just catching into the eye. And that's always what we want to achieve, because we want that the elderly people, they just live their life like they would like to. They don't need to wear anything. They don't need to be like frightened that the camera catches everything and so on. But still, they know that whenever they need help or they need support, they will get it fast and reliably. And still they can get their independence and dignity. So they just live their life and don't have to wear anything, so that everybody sees, oh, I need help. Still, the technology is very easy to use and implement, and can also be maintained very easily. And looking into the future, with all this data that we gather, we may also have something like health indicators, so that we can see illnesses or growing frailty much earlier. From a business model point of view, we want to make sure that it is affordable for everybody, which means that you can buy the hardware for a reasonable price. And then if you want to have more, we have something like a platform, and then you pay a monthly fee. But still, if you only want to get alerted, for example, when somebody falls or somebody gets out of the bed, you can only buy the hardware if you wish to. And I think we are definitely in a market that will be growing in the next years, because we have the demographic change. And so we want to support here with our technologies and help elderly people to live a life of dignity and independence, and also remain in assisted living or in their private households as long as possible. We have been awarded quite a few times already, for example, EIT Health or the European Commission, or also the German government. And at the moment we are active in Germany mostly, but also in Spain, for example, or Belgium. So thank you very much, and now I'm happy to answer your questions.
Great, thanks very much. Who are your main clients at the moment?
So at the moment it's mostly nursing homes actually, but also assisted living facilities. But we are moving more into the direction of private households. So for us it was easier to start with like nursing homes and so on to train the models, because in the end we don't use only sensors, but the key ingredient, so to say, is the software behind that. And it was easier to train that in nursing homes, for example.
So how many nursing homes are you operational in?
So at the moment we have around 130 installations.
Thank you so much for the presentation. I think what you are building, anybody operating the care in this space, is one of the biggest needs that we will have, so much welcome. But it's also one of the most fragmented markets. In Germany alone, there are 9,000 nursing homes, or care homes. Here in the UK, over 5,000. So any model that you will tackle is going to be very fragmented. So I wanted to ask you, even though you might be pivoting into B2C or direct to consumer, how are you going to scale with B2B partnerships? And who are you targeting for that?
So we quite tested some cases there, and we found that actually it's quite a good strategy to let these customers come to us. So we see actually so for example, when we talk to nursing homes, fall is a really big topic. So when we make sure that when people are researching for fall, they might come to us, actually it makes it quite fast. And even now in the times of COVID, we hear from a lot of startups, they have problems to get clients. We actually have a quite big interest and nursing homes coming to us. But on the other hand, we are also trying to work a lot with networks, for example, that we just spread the mouth and that everybody, or not everybody, but a lot of people get to know us.
Same question. Are you integratable with care planning software? I know Germany is very far behind on care planning software, but is that something you're working on or have an API?
Yes, we have an API. We have a RESTful API, for example. We don't have a software that we are integrated at the moment, but we are talking to some software providers in Germany to do that probably next year then.
And have you had any traction with hospitals at all?
We just started with some trials. Maybe some of you know Helios from Germany. It's a quite big hospital chain, and we have a trial there with 5 facilities at the moment.
Oh, that's great. Well, I can certainly say we could have done with that equipment when I was on the front line of especially with side rooms. So yeah, this is it's definitely a piece of useful equipment. I can see the use for it. I'm afraid that's our Q&A time allocation, Christian. Really appreciate what you've done there. Great presentation. But we're going to have to move on now. And
thank you.
Our next company up is Alio. Do we have them here?
Hi, everyone. Hi, this is Dave from Alio.
Hello.
Hello, how are you doing?
Yeah, good, thanks. Well, take it away, fella. Show us what you've got.
Sure. Awesome. Well, thanks again, everyone. It's a great opportunity to be here. I'm Dave. I'm one of the co-founder and CEO of Alio. We're focused on remote patient monitoring for vulnerable patient populations, initially starting with dialysis and heart failure. If we look at dialysis worldwide, it's a pretty large number of patients, about 3.2 million patients worldwide, about 1 million kind of in Europe. They suffer from 3 big issues that results in them staying a lot in hospitals. So it's heart failure, having potassium imbalances leading to arrhythmias causes a lot of ER visits. Also the fact that their vascular access in their arm is effectively their lifeline, allowing them to get the treatment that they need, can get blocked about 25% of the time in any given year, ends up resulting in a lot of frequent interventions that are required. In the US, if you look at this, it's a very small percentage of the population in terms of 1% of the Medicare covered population, but approaching almost 10% of their claim costs and about $35 billion. It's a pretty big problem. The big issue is that they're spending almost 2 weeks a year in an ICU. And so we see that effectively worldwide. They've mandated monitoring for most of these patients. So they have to either be brought into a clinic to have an imaging procedure done, maybe once a month, once a quarter. Blood draws are done as well to ensure whether or not the patient is doing okay. And unfortunately, it's a pretty clunky system right now. So a patient gets a phone call maybe a few days later after the blood draws come back from the lab, and it's pretty inefficient, and it's been really been tackled that something has to be done. So we've seen a lot of providers are addressing this lack of data with some pretty labor-intensive manual processes. So actually, the team up at NHS South Tees, they realized that this was a big problem. They actually wanted to tackle it by hiring a series of nurses to actually drive out to patients' homes a couple times a week, get blood draws, get vitals, and see that they actually could reduce those hospitalizations and visits. But as you might expect, the cost of doing that is pretty expensive, and they wanted to see if there was a more automated way to get that data. Thankfully, through some of the work that we had been doing already, we were able to bring in our end-to-end platform to start working with them. So it is a wearable that is worn by the patient. It is shower-proof, sweat-proof. The battery life right now is running between about 60 to 90 days. The adhesive is running on average between 7 and 14 days. The patient receives from their clinic, the trust, a box that basically they go home with. They plug that bedside hub there in the middle into their home. It is a chronic care population. We wanted to make it as easy for them as possible. We did a worldwide deal with Vodafone, actually. So it's up and running. As soon as the patient plugs it in, places the patch on their arm, everything's up and running. There's nothing else for them to press, do, set up, no Wi-Fi, no smartphone app to download. Everything is up and running. And then on the clinician side, we have a portal and an API for integration, but it's all focused on notifications. And the benefit in this patient population is that there are international guidelines around where patients need to be, so we don't have to come in and disrupt the clinical workflow. It already exists today, and people know really well what to do. And what allows us to get data and push past what Philips or Massimo are doing with the little red light on your finger in the hospital, or even an iWatch or Fitbit in the consumer world, is that we're able to actually not just get that data that's underneath the skin, but actually effectively get a 3D holographic image of whatever vessel that we're above. So this would be the vascular access for the kidney patient, the radial artery for heart failure patient, the carotid artery for stroke patients. It's a pretty innovative way to get a much richer data set in a seamless manner and not need any patient or physician interaction to get alerts when something is going wrong. In addition to what we can pull out of that rich data set, we translate that into more metrics. So being able to go past your basic vitals that a lot of wearables can do today to getting really into your cardiovascular status. So I mentioned dialysis patients. Part of the reason why we started there is their high rate of complications. So looking at heart failure, I mentioned 40% will be hospitalized. The fact that their vascular access is going to have about a 30% rate of failure in any given year. And then also looking at things like electrolytes, being able to non-invasively get potassium without looking at an ECG certainly has a lot of value to be able to do that today. It's obviously important to be accurate. So it's great that we can put up a lot of metrics up there, but if it's not worthwhile if we don't have the confidence of clinicians. We've shown our ability to do so with patients placing this product on themselves at home without us having to intervene and comparing ourselves to both blood draws and some of the systems that are utilized today that are either clunky or require an actual blood stick. If we look at what that means in terms of costs and savings, this was actually an NHS patient that we were tracking over time. We showcased the value. Their clinician had changed one of their parameters for one of their drugs that's relatively expensive. They otherwise wouldn't have presented to a clinic for a blood draw for a few more weeks. We were able to detect it early and save their provider about £1,000 just in that month alone, not to include the cost of also getting transported to a center to get the blood draw and everything else they need. And that same compelling outcomes are across over 250 clinical subjects that we've been able to work with so far. We've seen really strong data, and I think that makes us best in class in terms of a wearable. We certainly stand on the shoulders of giants, but the ability to go past where consumer products are, the limited insights from some more of the vitals companies, and then even the very robust metrics for some of the single metrics implantable companies that we see today means that we have a really big market that we can tackle long term. In terms of remote monitoring, we're already starting to see that pull happen for us. There's a real unique opportunity to start here in the dialysis market in terms of the alignment of the needs of the physician, the patient, the provider, and the payer as well, and what's out there in terms of reducing hospital stays, making the patient life a lot easier, and being able to redefine the current treatment paradigm that results in lots of excess visits and excess costs. And whether in the US and you're looking at more of a fee-for-service model, a value-based model, or even a single-payer model, we can fit in really well with that. There's a good incentive for folks to work with us in terms of cost savings, also new revenue here in the US for some of the providers. So there's a really great balance of the ability of from a business standpoint to great traction and create a great flywheel for what we're doing. Certainly some of the new reimbursement changes, the value-based care changes are certainly coming into place in terms of what we're able to do as well. We've got some amazing partners across both the US, the UK, and Europe as well, Maastricht, and then the University of Vienna as well, that we'll be starting off with here in Q1, Q2 in 2021. So we've already been doing a lot of work with the NHS and the South Tees team, tracking a small cohort of their patients over time. Pretty excited about that opportunity, and the team that's bringing all this to date is a really good blend of both med tech and medical and high tech innovators that have strong background in startups, quite a few exits under the team's belt as well, which we think makes us a really interesting opportunity to bring world-class wearables that generate clinically actionable data and then integrate those alerts into current clinical workflows for the best outcomes for patients. So thanks again for your time, and certainly happy to answer any questions you might have.
Thanks, Dave. Nice presentation, and that looks like a very interesting bit of kit. I have to ask, what's the cost for units to take this on board and implement it?
Sure. So right now, we've been looking in the US. It's been a per member per month model, so it's about $100 per member per month. They do have reimbursement that comes in to cover about $200 per member per month. So it's a pretty for whoever implements it, it's effectively a cost share. So we've been able to, I think, at that price point, be able to. It is a premium product. There's about 16 sensors inside of the patch. We also provide the entire service. So we're covering the cost of the cellular modem, for example. It's fully baked. So on our end, we provide, if there's any new kit that needs to be sent out to a patient, directly drop shipped to them, everything is fully covered on our end. We can see if things aren't working, and that whole piece is pulled in. So right now it's about $100 per patient per month. And so we're looking at what the pricing model will be in Europe a little bit more.
Hi, great solution. I got a question regarding partnerships. At the moment, what I see is a lot of B2C or B2G, if it's a hospital. But your sector, the RPM sector and IoT, is in consolidation already. So which kind of ecosystems are you seeing yourself in 1 or 2 years' time? Because everybody is positioning themselves in the horizontals in the RPM.
Sure, absolutely. So I think I think we looked at attacking the problem 2 ways, right? So found a very interesting patient population where we could, I think, really showcase value and start driving a very strong business model from a distribution standpoint to a reimbursement standpoint, et cetera. But yes, we are entertaining conversations with a few different folks that are in the RPM space, that maybe are in the heart failure space, or looking at folks that are doing managed population care as well, for a dialysis or heart failure population, integrating our platform into what they're doing. And there's on-ramps and off-ramps at every opportunity. So from a patch perspective, we can feed right into somebody else's hub. At the hub level, we can feed right into somebody else's care management platform. So it's certainly been set up to allow that to happen across the way.
How have you dealt with the issue of data validation, data updating, different participants inputting data? A lot of this sector is looking at sort of blockchain as being a potential solution there in terms of the sort of data flow. Is that something? Do you have solutions for that?
So right now, that's certainly something on the horizon for us. But right now, what we've done is that it's all raw data to the cloud. There's no patient identifying information anywhere until the pull request actually gets made at the clinic site. So they're the only people that have access to that. So it's not using like a full, that's kind of being set up, if you will, to be almost in a blockchain ledger type format. So we already utilize a ledger today that is completely different and apart from the actual data flow setup from patch to hub to cloud to clinic. The ledger then actually just pulls to whoever the box, the kit has been given to. That's how it actually gets pulled in. So it is set up to be able to integrate that in the future, but it's already a system that is well designed to protect patient information today.
So your cloud-based database is holding data that is compatible with NHS Fire and various other US comparables. It's multi-capable basically.
Exactly. So it's kind of already GDPR compliant, and it's already set up with, there's an AWS instance in each of those countries. On all those pieces are set up then for compatibility with that data flow.
I have a question actually regarding patients. As you are probably aware, many of the patients now are demanding access to their health data. Do you have any plans to have an interface for patients as well? That's one question. And the second one, you presented some of the devices existing on the market as being competitors, but did you think you could integrate with the data they provide and maybe enhance your product?
Yeah, so absolutely. So from a design standpoint, we actually spent a couple months actually embedded in a trust, actually kind of understanding the dialysis workflow and how it was different in different sectors. And so actually what we realized is they wanted limited feedback initially to the patient for this patient population. It is a chronic population. Clinicians didn't want people calling them up every time because of the high rate of failure or issues. They didn't want them calling up every time a metric moves by 10%. So initially right now there is feedback via the hub that if something's wrong, the light flashes, call your doc, call your provider and get moving. There is an API for a smartphone app that will actually start to then pull in the data that's relevant for the patient. But I think that'll be more things like nutrition data. So potassium imbalances, for example, are highly driven by diet in this patient population. So we're starting to track what can we do in terms of diet recommendations if the patient is getting close to an issue. That's not fully implemented quite yet in terms of the front end user interface, but the API for that is already there. Then from the standpoint of integration, we're certainly very open to partnerships. Working with others, we're looking at heart failure companies or ECG companies, for example, that might have a full 6 lead, integrating with us to get a full comprehensive cardiovascular suite. There's a sepsis company, for example, that has done looking at population health sepsis alerts, but they don't have an actual hardware. It's just pure software. So integrating with them, pulling all of our data together, so they're not just looking at a limited data set of heart rate, temp, and SpO2. Now we can push past that into BP, potassium, flow, looking at if their vessels are getting collapsed. That's a more rich data set for potential sepsis alerts. So we're looking at both software and hardware partners to integrate the data with.
Thanks, Dave. I'm afraid that's our time run out now, but yeah, very competent job there, and looks like a very interesting bit of kit you've got. So thanks very much for presenting that with us today. And hopefully we've got melting ice cubes ready to rock and roll for our next presentation.
Hello, my name is Morgan Maddox, and I'm really pleased to be able to speak to you about Melting Ice Cubes, our health platform. We simplify health search and we help people to build health literacy. We know that this is important because of family circumstances we have faced, but actually you talk to most people who have been through health challenge and they will all tell you that it is associated with anxiety and concern and fear. So people do look online, they are using e-health tools, but there's always that risk element, isn't there? Who, what, and quality. Also the volume of information that's available. What's the right question that you need to ask to pull back the information you need? These are some of the problems that we need to fix. Medical terminology and being able to manage your health with medical professionals. If you understand your health, then you'll do a much better job of having conversations with medics. I think the NHS model does actually foster a delegated healthcare culture, but if we can address that and if we can equip people to be able to speak in partnership, that has benefits for everybody. So the solution that we came up with was our platform. You type in a condition, you can see here, we populate your screen then with related content. So we search the internet with our algorithms and we sort information and categorize it. We're currently refining all of this with that we've built a validator tool that is indexing and giving us even more refinement on the information we present. You can see here there's an everyday life search that's in play, and it's helping somebody to find out how it affects their day-to-day life with travel. You might have more than one condition, that's absolutely fine. 1, 2, 3, we don't mind. Add them all in here and we will bring back the information that you require. So sorted information, fast tracking your search. Our target market then has to be playing to people who want information related to health, and it does. So we've got Joe Public, but we've also got medicals, medics in terms of GPs, consultants, nurses, support organisations and students. They all do come to the site and use it as a reference source, and that's we have international users too. So we can tell you that we've got around 30,000 people trafficking through the site, and they're drawn from 22 countries, mainly the UK, but 22 countries there are regular users hitting us. So that creates an exciting target market, the possibility to go worldwide, and our revenue model is a freemium ecosystem. So we're building a value network. We're not in competition, we want to collaborate, we want to associate with the suppliers of goods and services in the benefit of B2C and B2B relationships. And what does that look like? Premium subscriptions, social prescribing, medtech partnerships, sponsored content from pharma, affiliate sales, click-through, products and services, consulting. We don't look at advertising yet, but that is something that we can also add on in a controlled way. So our acceleration strategy is absolutely essential now. We need to push on with our product development. We need to develop the ecosystem and establish the brand. And so the investment that we seek is in support of this. We've spent 350,000 to date, and that's got us an MPV with users. An investment of $1 million should see us deliver our plans, and year one yields 17.5 million in income, and that's conservative modelling. Competitive advantage, nobody does this like we do it. We stitch the elements together in a new and interesting way, and we really are building an ecosystem, an environment that is capable of supporting multiple audiences for a variety of reasons. The validator tool is really exciting because this enables you to view our information at a broad, high level, or really drill down to precise detail, even down to what is it I'm going to look at now? Is it going to be a video? Is it a journal? Is it a report? Who's giving me this? And our services point the UK market to local, regional and country support, and of course that can be replicated abroad. So here's Colin. He's much more comfortable now. He's not bouncing happy, but he's comfortable, and he knows where his information is. It's on our platform, and it also gives him access to an ecosystem that gives him goods and services. We've answered a lot of those questions. We definitely know who, what, and the quality. And there's some larger society improvements too. It does create efficiencies for healthcare delivery, definitely supports mental health and improves the health of the nation generally. So this is the team that have built the platform. Experienced team here. We buy in additional services where needed, but if you want to speak to us, there we are. And if you want to join us on this journey in building an ecosystem that supports health, we would love to speak to you. Thank you.
Great. Well, thank you very much for that presentation. Very interesting. Over to the panel for questions.
I can start. So where have you got to with validate? Because I appreciate it's early days, but where have you got to with validating the different kind of revenue options that you've mentioned? You're muted, sorry.
You'll need to unmute yourself.
Sorry. I've had conversations in each of those spaces that we mentioned there. So we've spoken to people regarding the NHS and social prescribing. I've spoken to, just have a look at my list here, universities, colleges, businesses, charities. In each of the areas that I have listed, I've had physical conversations with people and their interest in being able to work with us.
Great, thanks.
I got a question. Hi, I'm Olivia. Congratulations on how far you come with the platform. My question is about the scope of the platform, because obviously from a content perspective and from a segment perspective, we cannot do everything at the same time. Yeah. So I wanted to ask you, how do you sort out the complexity of dealing with any probable combination from the content perspective, meaning who are you partnering with to bring those localized, more patient-centric services, just to fast track that? And maybe if you could offer from all these conversations you just had mentioned with the different segments, which is going to be your starting point or where you see the most traction?
I think that is the challenge that we've always faced. And if I can just give some context why we've made that decision. So as our family had to support somebody who had degenerative condition from their childhood into adulthood, that means you don't have the luxury of being able to confine your thought process to one area. You know, you are immediately impacted by understanding the condition, understanding the treatment pathway, the medications, the therapies. How does this affect education, the care supporting the community? How do you get on with life, travel, work, etc.? And so I have always had a 360-degree view of impacts to a person and a family of ill health. So with the challenge we've had for about 10, 12 years was everybody always saying, you can't do it all. But with the team that we've got together, with the AI that we've built and the algorithms, we are able now, you take any condition, you plug it into the platform, and though the tool goes and drags the information in. So every day we get requests from the public saying, can you add my condition, add my condition. I think we've got over 650 conditions now. So the tool is the instrument that goes out and sorts the content, and then we organise it. Mitchell's working on the validation tool now, and so the data is being checked, referenced, organised. It's like we've taken a library that had millions of books on the floor, and we're now putting them on a shelf in a neat and organised way. I think that's really important for a person who comes to the platform. They can segment how do they want their information. Is it medical related? Is it life related? The social media layer on top enables them to reach out to other people, create communities. And that is why the ecosystem can work. You know, the people that I've heard today on this call, you know, Ali, Chin, Nevis, DNA, Pal, Glofax, those are all people that could be part of our ecosystem. We're not competitors at all.
That's answer the question. So you offer the platform as the service. Yeah. Thank you. Thank you.
And what's your revenue model?
It is built around the different strands that we can attract. So, for example, the man in the street, he can always access us for free, but he might want to buy the premium model. He might also want to purchase products and services. Medical deliveries, we may develop relationships with them that enables us to build the social prescribing. MedTech would be affiliate, care support would be subscription, pharma would be sponsored content, organisations and businesses would use us in their employee wellbeing offering, education, we could build an education hub, because lots of medical students they love our platform. One word in, or you know, all of the content that you need in one click. So it's a variety of ways to attract revenue, and our strategy is to onboard a sales team and partnership development team.
Do you see this as a global proposition or purely UK based?
No, absolutely global. But we built the tool first just for the UK with all UK IP. What we found is it's from 97 countries, 22 countries use us regularly. So this model can be replicated in every country.
You mentioned IP. Do you have IP in terms of the search algorithms? Is that the point?
I think our IP is in the data collation and the way that we present it. So it's the way that we put things together. Joel, would you agree with that?
Yeah, I'd agree with that. The data is obviously public data, which is the way that we take that data and present it in a way that makes sense to people for their particular time of search and their particular time of life, you know, whether that comes in from a health point of view.
What is your trust model? Because presumably you're collecting a lot of data about the user in background, and that data, I was going to say traditionally, but I guess that's as good as any, traditionally is being sold to Google. Is that a sort of approach that you'll take as a revenue model?
No.
No, our intention. No.
And how will you prove that that is the case?
Gathering personal data about users. So we will gather enough data so they can log into an account, but their accounts remain anonymous. There's nothing we can identify users with.
Okay.
We build up trust by, we ask for very limited information, but the more a user is willing to give us, the more we can refine the data for their requirement. So it's a trust model, that they'll trust us. As they trust us, they might provide more information, maybe around their age range, location, and then we can make services more specific to them.
Okay, thank you. I'm going to have to call an end to it there. We've allocated time has run out. We now need to make our decisions, and me and the judges are going to need to have a chat. So thanks very much for that presentation.
Yeah,
really
thank you very much for your time.
Thank you.
Thank you.
Cheers. Thank you.
Hi, I'm Jen Esterby, Health Tech Lead.
And hi, I'm Dawn Carhart, Health Tech Manager.
Barclays Eagle Labs are proud to be the premier innovation partner for the Giant Health 2020 virtual event. Today, we're going to give you a bit of an overview of Barclays Eagle Labs and what we're doing to support the health tech ecosystem.
So, what is Eagle Labs? So, with a growing number of Eagle Labs across the UK, our focus is to help accelerate UK scale-ups, promote collaborative innovation across the entire ecosystem, and enable access to and training on new and emerging technologies.
Since launching 5 years ago, we've grown our network to 26 sites across the UK, each one unique in its partnership and offering. Our collaborative spaces offer co-working, private office, rapid prototyping facilities, and enable startups to connect with like-minded businesses to help them innovate and grow. Our reach is far wider than our physical network, and around about 2 years ago, we started looking at particular industry sectors where we felt they were ripe for disruption, where there were more startups and investment emerging, and we identified health tech as one of those, along with a few others that are listed here. We have a network of peers, mentors, partners, and experts who can help you achieve your business ambitions, and have built up an ecosystem of over 360 health tech businesses. We have over 600 residents in our physical network who have raised over £1 billion in funding. And by being a member of Eagle Labs, you'll have access to 38 innovation partners.
And if you're a health tech business or in the health tech industry and space, then you want to find out more, then please get in touch via our website, which is on screen, also our email and our Twitter page as well.
Or if you're at the Giant Health event over the next couple of days, feel free to visit our virtual stand where you'll be able to live chat with ourselves and some of our colleagues, and also have access to some video and other content about the proposition.
Well, I guess this makes us live, and I want to thank everybody for their contributions today. There's been some really strong pitches. There's been some excellent ideas, and it's been a really tough decision. And for the record, just so everyone knows, every category was a split decision. It wasn't clear in any area. So take consolation for anyone that hasn't won anything today. You probably have won something as far as the judges are concerned. So without further delay, to put you out of your suspense, there were 3 categories and an overall winner. So we had the pollen, the sprout, and the bean categories. So in the pollen category, our winner was Chin. Well done. Excellent job. In our sprout category, our winner was Kepler. Well done. Excellent job to you guys. And in our bean category, the winner was Alio. So very, very well done to everybody in their individual categories. They were all tightly contended. And speaking of tight contention, the overall winner sparked a huge debate on the judges panel. So it's been very exciting times. There's been some differences of opinion, but we have come out with an overall winner. And now that I've rolled out the suspense just about as long as I can, I shall announce really well done to Chin, who win the overall award. Congratulations for very high standards this year.
Well done, Chin.
Thanks all for getting involved.